When someone has a cardiac arrest, recognized cardiac arrest, call the ambulance. Government has to ensure that the ambulance system is perfect. Reaches what you told. 3 minutes, not even 3 minutes. Let it come within 5 minutes. The survival rate is good, but it should not be more than 10 minutes. Ask everyone to learn so that they place the high quality CPR, perform hands only CPR, place the heel of the hand over the center of the chest. Again, viewers learn this. Center of the chest 100 to 120 times a minute, at least 2 inches or 5 centimeters in depth without any interruption, and the chest wall has to recoil back to its original position. Another suggestion to the government is whenever you visit any place in India, at least majority of the public places where we have identified in my research in media reports, Goel sir and Paul sir and Dr. Rashid, please ensure that your patients who are VIPs see that they install this in the public place. How much does it cost? Just 75,000 to 1 lakh, not more than that.
In the media conference with Lal Goyal, which is brought to you by V4 News, Global TV, V4 Stream, Malnadu TV, News Gaon Se, Samvad Sarokar News, Organ Donation India Foundation and Gyan. Our endeavor is to enlighten you with the current topics and especially the impact of COVID-19. But today we are taking a very, very serious topic, and that is CPR. But before I will go to that topic, I would like to inform that today the world is celebrating International Day for Preventing the Exploitation of the Environment in War and Armed Conflict. The United Nations General Assembly declared 6th November of each year as the International Day for Preventing the Exploitation of the Environment in War and Armed Conflict. Though humanity has always counted its war casualties in terms of dead and wounded soldiers and civilians, destroyed cities and livelihoods, the environment has often remained the unpublicized victim of war. Water wells have been polluted, crops torched, forests cut down, soils poisoned, and animals killed to gain military advantage. Furthermore, the United Nations Environment Programme UNEP has found that over the last 60 years, at least 40% of all internal conflicts have been linked to the exploitation of natural resources, whether high-value resources such as timber, diamonds, gold, and oil, or scarce resources such as fertile land and water. Conflicts involving natural resources have also been found to be twice as likely to relapse. The United Nations attached great importance to ensuring that action on the environment is part of conflict prevention, peacekeeping, and peace-building strategies, because there can be no durable peace if the natural resources that sustain livelihoods and ecosystems are destroyed. We wish, firstly, that no war should take place, but in case of war or armed conflict, no exploitation of the environment should be there. Now, I would like to come to our topic, that is CPR. I think it is good for everybody to know and learn CPR. It is good for me because I get to live. Take some time to learn first aid and CPR. It saves lives and it works. Cardiopulmonary resuscitation, CPR, is an emergency procedure that combines chest compressions, often with artificial ventilation, in an effort to manually preserve intact brain functions until further measures are taken to restore spontaneous blood circulation and breathing in a person who is in cardiac arrest. It is recommended in those who are unresponsive with no breathing or abnormal breathing. CPR alone is unlikely to restart the heart. Its main purpose is to restore partial flow of oxygenated blood to the brain and heart. The objective is to delay tissue deaths and to extend the brief window of opportunity for a successful resuscitation without permanent brain damage. Administration of an electric shock to the subject's heart, termed defibrillation, is usually needed in order to restore a viable or perfusing heart rhythm. CPR is indicated for any person unresponsive with no breathing or breathing only in occasional agonal gasp, as it is most likely that they are in cardiac arrest. If a person still has a pulse but is not breathing, respiratory arrest, artificial ventilation may be more appropriate. But due to the difficulty people have in accurately assessing the presence or absence of a pulse, CPR guidelines recommend that layperson should not be instructed to check the pulse while giving healthcare professionals the option to check a pulse. In those with cardiac arrest due to trauma, CPR is considered futile but is still recommended. Studies have shown that immediate CPR followed by defibrillations within 3 to 5 minutes of sudden VF cardiac arrest dramatically improves survival. And to discuss this point, to discuss this topic, we have a very, very elite, educated, qualified, experienced doctors, cardiologists with us. They will be explaining about the CPR in detail. I would like to invite my first guest, and he is Dr. Srinivas Ramka. Dr. Ramka is MD, DM, FACC, FAHA, FCSI, FIAE. Dr. Ramka is the consultant cardiologist of Srinivas Heart Center and chairman of Srinivas Heart Foundation, Warangal, Telangana. He received the 2014 AAPI Global Health Summit Award for Community Services on January 3, 2014 at Ahmedabad from present Prime Minister Honorable Shri Narendra Modi. Dr. Srinivas conducted the largest CPR training program for lay public in 2012, in which 4,000 people were trained in CPR on a single day. This is published in the 2014 Limca Book of Records as the most people trained on CPR in a day. He was the speaker at the World Congress on Cardiology held at Dubai in 2012. He presented research abstract at the World Congress of Cardiology 2016 at Mexico City. He conducts World Heart Day patient education programs regularly from 2001 based on the World Heart Day themes. Welcome Dr. Ramka on our show. Dr. Srinivas, you are doing so much things about the CPR, and you have a Limca Book of Record of 2014 for doing the maximum number of training in one day. That is 4,000 people were trained on CPR. Now we would like to know more about CPR. Dr. Srinivas Ramka, please. Please unmute yourself. Yes, doctor.
Good morning, Sri Goyal, Sri Paul, cardiology and doctor colleagues from India, and viewers of V4 News and Global TV viewers. Good morning to you all, whoever is seeing this program. First, I would like to thank Global TV, V4 News, Sri Lal Goyal for conducting this program on a very important public health program in the world. There cannot be any more important public health program which a lay public has to learn than cardiopulmonary resuscitation, or shortly CPR in short. Now I would like to tell what is CPR, what is sudden cardiac arrest, what a layman has to do in situations of cardiac arrest, and what is conventional CPR, and what is how a person has to do in situations of cardiac arrest in out of hospital situation. What is sudden cardiac arrest? Sudden cardiac arrest is the most important public health problem throughout the world. In situations of sudden cardiac arrest, doing hands-only CPR is proven scientifically to revive the victim of sudden cardiac arrest. The most common cause for sudden cardiac arrest is a heart attack or an acute myocardial infarction. In India, for every 1 lakh persons, 4,000 people are supposed to die from a cardiac arrest, particularly sudden cardiac arrest. What is sudden cardiac arrest? In situations of sudden cardiac arrest, the person loses consciousness. He collapses suddenly. There's no pulse, there's no breathing. There can be prior symptoms like chest pain, breathlessness, palpitations, nausea, vomiting. Symptoms may be there or may not be there also. The common cause for sudden cardiac arrest is an acute myocardial infarction in medical parlance or a heart attack in the layman's terms. What is a heart attack? Sudden cardiac arrest and heart attack are different terms. In situations of heart attack, a person may sustain a sudden cardiac arrest. And in situations of sudden cardiac arrest, doing hands-only CPR is proven scientifically to save the life of the cardiac arrest victim. Now, cardiac arrest is of two types. It could be an in-hospital cardiac arrest or out-of-hospital cardiac arrest. In out-of-hospital cardiac arrest situation, where there is no trained people and where the lay persons are moving about like a railway station, airport, malls, or most commonly a home or residence, in such situations, what is called out-of-hospital cardiac arrest, the actions done a trained rescuer at that time, most commonly a lay person, is proven to save the life of the cardiac arrest victim. Hence, every person has to learn CPR. In an in-hospital situation, the survival rate is usually more than 80 or 90%, depending on the hospital. But in the out-of-hospital situation, the survival rate of a sudden cardiac arrest victim is usually less than 10%. Hence, to improve the survival rate of out-of-hospital cardiac arrest, which is the most common public health problem throughout the world and most commonly due to cardiovascular disease, it is very important that a lay person or a bystander has to be trained in CPR. What is CPR? CPR or cardiopulmonary resuscitation are the series of life-saving actions done in situations of cardiac arrest. Okay, now what is a heart attack? A heart attack, which is common cause for sudden cardiac arrest. In that situation, the blood vessels supplying the heart, either three main vessels or one of them, most one of them will be suddenly blocked. There is a blockage of the blood supply to the heart muscle, and then it leads to heart muscle death, necrosis, or myocardial infarction. In such situations of heart attack or acute myocardial infarction, the heart rate becomes dangerously irregular, what you call as ventricular tachycardia or ventricular fibrillation or in pulseless ET or in asystole. In such situations in medical parlance, the heart stops functioning, and when the heart stops functioning, which is the main pumping organ of the body, the blood supply to the brain stops suddenly and the person collapses suddenly and loses consciousness. In such situations, if hands-on CPR is done, so early CPR, the earlier you do, the more the chances of survival of the person, and hence everyone should learn hands-only CPR or cardiopulmonary resuscitation. What a layman has to do is called as hands-only CPR. Now, the American Heart Association, the American College of Cardiology have given what is called the chain of survival concept. In situations of cardiac arrest, recognition of cardiac arrest is the first thing. Two, activation of the emergency response. Two, performing hands-only CPR or high-quality chest compressions is the second thing. Then using defibrillator, a automated external defibrillator or AED is the third thing, AED. And the fourth one is advanced resuscitation. And the fifth one is post-cardiac arrest care, which is done once the victim is shifted to the hospital. And now 2020 guidelines of the American Heart Association says the sixth one is added, what is called the recovery phase of the cardiac arrest victim. Now, I will demonstrate what a layman has to do hands-on CPR in situations of sudden cardiac arrest. Just a minute. The most important thing in any CPR training program is learning the chest compression perfectly. So I request all the viewers to watch this important program. Is my mannequin visible?
Yes, please.
Okay. Yeah. In situation of sudden cardiac arrest, first recognition of cardiac arrest and activation of the emergency response is the first step. How do you recognize cardiac arrest? The person is not responding to commands. The person is, if you tap him, if you do not know him, or if you call by name, if he is not responding, then because that there is a cardiac arrest and there is no breathing. The lay person need not check the pulse as per the AHA guidelines. So no response, no breathing, and immediately activate the emergency system in your area. Now in US it is a 911. Every country has its own emergency response, and in our country the most important one is a 108 in most of the states. So call the emergency. Yeah, there's a cardiac arrest here. Please come immediately. You dial 108 and ask the ambulance to arrive immediately. No, that's the first step. Second step is doing the high quality chest compressions or high HQ CPR. Now, how do you do high quality chest compression? Is the most important event. So I request all the V4 viewers, the global TV viewers, and everyone to watch this. Once you recognize cardiac arrest, activate the emergency response. Place the heel of the hand over the center of the chest. Center of the chest, lock it with the other hand. The steps in or important points in the high quality chest compressions are push hard and push fast. 100 to 120 times a minute, at least 2 inches in depth or 5 centimeters in depth without any interruption. And if you are tired, the other bystander has to take over this. So these are the most important points. I will demonstrate. Place the heel of the hand over the center of the chest, along the imaginary line on the nipples, just above that, in the center of the chest. Lock it with your hand and push hard and push fast. 120 times a minute, at least 2 inches in depth, and the chest wall has to recoil back to its original position while doing chest compression. This is the correct way of doing chest compressions. Okay, so this is the second step. While doing the chest compressions, if an AED is available, automated external defibrillator is available, get it to the scene and use it. Now, most of the viewers might not have seen an AED. An AED or automated external defibrillator is a computer-like equipment. It's a portable equipment. It is installed in most of the public places anywhere in the world. In the railway station, airport, malls, bus stations, in municipal buildings, in the residential apartments, condominiums in US, and in entertainment places like the Disney elsewhere in the world. We do not have many of the AEDs installed in our country except a few airports in the country and some of the hotels. Okay, these are all the public places need to be installed with an AED. So an AED works, most of the US might have seen what we call the manual defibrillator in hospitals, what a doctor uses. But a manual defibrillator, the doctor will recognize the rhythm on the...
Doctor, please bring it more further. This side. Yes. Now it's...
This is a manual defibrillator, but a manual defibrillator, the technical person, the medical person will recognize it. But in a lay person situation, this is a manual defibrillator. We place on the chest and give a defibrillation or give a shock. But in a lay person place, like in a railway station, airport, an AED is very useful, and AED has to be installed. There is no monitor. It itself works the pre-programmed instructions in different languages is also available. Now we have demonstrated the use of an AED, which is the third step in the chain of survival, defibrillation. This is a training instrument only. It says remove clothing from the person's chest. And attach the pads. These are the pads which are attached. We have to plug in the connector. We have to only follow the instructions of the automated external defibrillator, and it will recognize whether the person needs a shock or not. It itself will analyze the result. I'm showing it. It says shock advice.
Everyone stand clear. Everyone stand clear. Push the shock button. Shock delivered. Begin 5 cycles of CPR.
So this is how an AED works, and on any real-time AED also will be of the same thing. So this is of the AED. Once if the person, even if the AED is not there, the person has to do hands-only CPR continuously. After an AED usage, then if an ambulance arrives on scene, we have to shift him to the ambulance. Paramedics will take over. There's the next step, and after that, transfer into the hospital doing post-cardiac arrest care, and the other one is, last one is the recovery phase. So in situations of sudden cardiac arrest, these are the 2 steps. Recognize cardiac arrest, activate the emergency response, do hands-only CPR. Now, what is conventional CPR? 30 times chest compression and 2 times mouth breathing is conventional CPR. Doing such cycles 5 times in 2 minutes is conventional CPR. But even if a layperson is not trained in mouth breathing, he need not do the conventional CPR. Doing hands-only CPR is equal to doing conventional CPR. Now, after this, in situations of this, CPR is useful in all teens and adults who do not have respiratory problems. But in situations of drug overdosage, drowning, or any intoxication, mouth-to-mouth breathing is also equally important. Doing that is very important. In situations of cardiac arrest, because the primary is a cardiac cause, there is already some oxygen left out in the lungs. The initial for doing the chest compressions is the primary thing, and hand service, the oxygenation or mouth-to-mouth breathing is the later one. But in situations of drug overdosage in infants and in drowning situations, doing mouth-to-mouth breathing is very important. How a hand-only CPR helps? What is the science behind in this hands-on CPR? It will activate the inactive heart. The ATP, the earlier you do CPR, the person the chances of more, and the ATP, if you do not do CPR, the ATP in the heart, which is the energy for the heart muscle, adenosine triphosphate, will shortly, within a short time, it will totally be depleted. By doing the hands-on CPR, we are activating the heart, we are improving the blood supply to the brain, seeing that the ATP doesn't deplete, and then the chance of success of defibrillation are more if you do a hands-only CPR immediately, and if an AED is available or if the paramedics take over, the initial performance of hands-on CPR will improve the chances of survival of a cardiac arrest victim. It will improve the chance of survival by 2 to 3 times, double or triple the chance of survival. And hands-on CPR can save the life of anyone. It could be a friend, relative, or anyone going on the road. So we have to always follow the good Samaritan rules and perform hands-on CPR. Again, viewers, recognize cardiac arrest, activate the emergency system in your area, perform high quality CPR, place the heel of the hand over the center of the chest, lock it with the other hand, push hard and push fast, 100 to 120 times a minute, at least 2 inches in depth or without any interruption, 2 inches or 5 centimeters in depth without any interruption, and the chest wall has to recoil back to its original position when doing hands-on CPR. This is hands-on CPR. Each one of you have to train other one in hands-on CPR. The hands with only 2 of your hands can save the life of a person, and that is hands-on CPR. Thank you so much.
Thank you very much. Thank you, Dr. Srinivas Ramka, for showing the and demonstrating about the CPR, which I am sure our viewers have seen, and they will definitely follow how you have explained everything in such a nicely, and they will definitely can save lives by using the hand CPR. Now, I would like to invite my next guest. He's Dr. Manish Rai. I will just see whether he's there because he is having some operations. If he's not there, then I will move to my next guest. No, I think Dr. Manish Rai is not there. So I will like to move to my next guest, and she is Dr. Rachel Daniel. Dr. Rachel Daniel is MD Medicine, DNB Medicine, DNB Cardiology. She is the Chief Interventional Cardiologist at NS Memorial Institute of Medical Science, Kollam, Kerala. She is recipient of A.V. Gandhi Award for Excellence in Cardiology for the Best Research Paper in 2007. She is National Gold Medal winner for DNB Cardiology in 2007 from Kerala Institute of Medical Science under Padam Shri Professor Dr. Vijay Raghavan. She is interested in preventive cardiology. She is actively participated in World Heart Day activities for last 12 years with Heart Day Run, thereby propagating Heart Day messages. Being COVID this time, her team has prepared an excessive exercise video for heart patients. Welcome, Dr. Rachel Daniel, on our show. Dr. Daniel, you have seen what Dr. Srinivas Khemka has demonstrated, how the hand CPR can save lives. Now, we would like to know from you about the CPR. Dr. Rachel Daniel, please.
Thank you, sir. First of all, as Dr. Srinivas sir mentioned, this is a very, very rare topic in a non-medical forum. So I congratulate you for selecting this topic because this is the most reliable, socially important topic, because once you know this, you can save life. The other majority of the time, what we are saying are only just talks. But this is something which is really helpful to the society. Srinivas sir has extensively showed what CPR is. CPR is a life-saving procedure that is done when a person's heart stops pumping, stops beating. So it is called a cardiac arrest. Sir has mentioned what cardiac arrest is. When the patient is in cardiac arrest, that his heart will stop pumping. That is totally different from a heart attack. Heart attack is a situation where the blood flow to the heart is blocked So it is mainly a clot problem, but cardiac arrest is an electrical problem. So we have to understand that heart is a 250-gram organ situated in the center of our chest. So it has got anteriorly one bone called the breastbone, that is called the sternum, in front of the heart. And behind that, we know there is what is called a vertebral column, through which the spinal cord moves. So in front there is a bone, back there is another bone. So within these two lies the heart, which is a muscular organ. So what the CPR does is, when it starts stopping, what the CPR is going to do is, we are squeezing this muscular organ between the anteriorly placed breastbone and posteriorly placed vertebral column. So when you compress between these two bones, this organ which is inside will start pressing, not the way it normally functions, but at least some part of it will go pump and some blood will go, not essentially to all organs, but at least to the brain, where if the blood is not coming to the brain for 4 to 5 minutes, whatever done later in your in the course of the disease, if you can able to start the heart later with the medicines or any other treatment, once the blood to the brain is stopped for 4 to 5 minutes and more than 6 minutes, the brain will not recover. So there will be brain death. That is the importance of CPR. An early effective CPR means you are making the heart pump, at least little flow is going from the heart to the vital organs, especially to the brain, so that the brain cells are getting blood. That is, once there is an effective treatment comes by medical personnel, or you are reaching the hospital, or as sir said, 108 ambulance is coming and the expert paramedical staff is taking care of the patient. By that time, the heart should pump, at least little more flow should be there, so that the brain function remains little active. Otherwise, after 5 to 6 minutes, if the brain function stops, there is whatever you do, you can make the heart pump, but you can't make the brain function. That is the importance of cardiopulmonary resuscitation. Cardiopulmonary resuscitation is otherwise we can call cardiopulmonary cerebral resuscitation. Cerebral means brain. So it is basically for the brain that we have to pump. But usually we can see that the patients will be brought from outside by very effectively. They will bring the patient by car, making all sirens. They will push the patient to the hospital. What happens is, by the time the patient reaches, we may be able to restart the rhythm by giving all injections with medicines and all those paraphernalia, but the patient will be vegetative state. Patient won't be conscious afterwards. So if you know, anybody in the society knows how to do a CPR, if you find a person in cardiac arrest, if you do whatever Srinivas sir has told, at the right time, at the right place, then you can save a patient once the patient reaches expert hands. That is cardiac resuscitation. Then the rest of the things sir has mentioned, there are many of the problems happen in out of hospital cardiac arrest. There are so many causes for out of hospital cardiac arrest, but whatever done, you have to do it at the right time, at the right place. Then only the effect of cardiopulmonary resuscitation will be there in the subsequent time to come. There we have with electrophysiologists who will tell what is the problem with the rhythm and the cardiac arrest. So I'll stop it here now, sir.
Okay, thank you. Thank you very much, Dr. Daniel. And Dr. Daniel has explained further what Dr. Srinivas, because Dr. Srinivas has given the demonstration and Dr. Daniel explained how the heart muscle in between the two bones, and once we will be pressing that two bones, the top bone, the muscle will press, and because of that, some flow of the oxygen goes, or the blood goes to the brain. And according to Dr. Daniel, if the brain will not receive the blood for 6 minutes, then it is not easy to revive the brain dead person, because then the person will be brain dead, even if the heart will be revived. So it is very essential to revive. If you want the patient should be in a totally normal condition, one must give this CPR immediately without losing any time. Thank you very much, Dr. Daniel. I am sure the way you have explained further what Dr. Srinivas has demonstrated will definitely give a clear picture to our viewers. But we will go to now our next guest. He is Dr. Manish Rai. Thank you, Dr. Daniel, for giving your views. Now, I would like to invite Dr. Manish Rai. Dr. Manish Rai is MBBS, MD, DM Cardiology, Fellowship in Cardiac physiology. Dr. Rai is the consultant cardiac electrophysiologist at KMC Hospital, Mangalore. He secured gold medals in MBBS for pathology, ENT, and surgery. He was also awarded the TMA Pai, founder of Kasturba Medical College, Blue Ribbon Award for the best outgoing MBBS student for securing the highest collective numbers of marks in all the subjects throughout the MBBS course. He secured gold medal in MD and was also awarded the best thesis award for his dissertation on comorbidities and outcome study in diabetic foot. He did his DM from Sri Jayadev Institute of Cardiovascular Science and Research, SGICR, Bengaluru. He published 20 research papers in reputed national and international journal. Welcome, Dr. Rai, to our show. Dr. Rai, you have seen how Dr. Srinivas has shown the demonstration on a mannequin about the CPR, and described how when there is an emergency. Dr. Daniel explained further about the blood flow, and she said that if it will not reach to the brain, then after 6 minutes the patient will become vegetative and it will not revive the full brain consciousness after this if the blood will not go. Hence, both have asked the general public to learn the CPR and give timely without losing any time. Now, we would like to know from you about the CPR. Dr. Manish Rai, please.
So I just heard my colleagues, they spoke excellently on CPR and they're doing amazing work. So I just wanted to stress on a couple of points. One thing is, during a cardiac arrest, the chance of survival comes down with every passing minute. That is the key home message. So, if you're 1 minute late, your chance of survival comes down by 10%. And if you're 5 minutes late, it comes down by 50%. And if you're 10 minutes late in providing CPR, your chance of survival is 0. That is the key home message. And CPR should be done by everyone, just like what my colleagues stressed on the point. It has to be learned by every child. It should be a part of a curriculum. Now the thing is, another point that I want to drive home is, like another of my colleagues said, the chance of survival in an out of hospital cardiac arrest is 5%. So even if you provide CPR, the chance without CPR is less than 5%. Even if you provide CPR, the chance of survival comes up a great deal. But what if you involve the community in CPR? So there was a small study in the US, I think Rochester community study, wherein they tried to involve the community in the CPR. So what they did was they trained these policemen, firemen, teachers in providing first aid and including defibrillation, not just first aid, including how to defibrillate. And what they found was, compared to the rest of US, in that community, when the bystanders were involved in CPR, the chance of survival came up to 40%. That is amazing. From 5 to 10%, by involving the community, you're increasing the chance of survival to up to 40%. So that is a key message. If everyone knows CPR, there's a chance that the sudden cardiac arrest victim will survive. But if nobody knows CPR and CPR is left only to doctors, then 100% sudden cardiac arrest is going to kill a lot of people. And that is it's high time that our governments realize that CPR is not optional. It has to be mandatory. Everyone, just like a driving license, anytime you want to take a driving license or you have to pass college, you have to know CPR, because there's nothing more important than saving someone's life. And this is the only skill that will help you save someone's life, nothing else. We tried the same thing. We tried a concept in Mangalore called Savior. What we did is, Savior came from the idea that in India, it's easier to get a pizza than an ambulance. So you'll get a pizza in 15 minutes, but you'll get an ambulance in 1 hour. That is shameful, because a patient who's having a sudden cardiac arrest has got less than 5 minutes to survive, and you need an ambulance faster than that. So we tried, and you can get a cab faster than that. So we tried an ambulance pooling platform, wherein we involved all the ambulances in the city, and we connected them to an app. And in a single click, someone could get an ambulance. It was just a pilot project. And we found that, in the call that we did, we could get, a response time of under 10 minutes easily. And at the same time, we tried to educate the community. Over 1 year, we involved a lot of college students, and we involved a lot of teachers, trained them in CPR, gave them certification, and involved them in the program. So when, in the app, when someone clicks for an ambulance, not only the ambulance comes, but also the first responders who are trained and registered in the app get the message. So imagine there's a building, 10 floors building, and something happens in the 9th floor or something like that. So by the time they call for an ambulance, if someone in the building who knows CPR can come and resuscitate or help them, so it'll save them a lot of life and probably save a life. So that was the concept of Savior, and we did well for for a year or something. It was just a pilot project, but obviously we could not scale up because of all the financial issues and all those things. But I think it's high time the government takes up projects like this, wherein they train people, train doctors, train firemen, policemen, and make sure that anyone who with a degree or with a profession should know CPR so that they can come of help in terms of cardiac arrest.
Thank you, Dr. Rai, for giving your views. And what Dr. Rai says, yes, whatsoever Dr. Srinivas and Dr. Daniel has mentioned, but he is clear. He says that the CPR has to be learned by everybody, because he has quoted about one study which clearly mentioned that if you will give the CPR, the chances of survival is up to 40%. Otherwise, it is less than 5%. So one can very well see how one can save the lives. And he mentioned about how they have started a pilot project in Mangalore, where they have connected all the ambulances with one app, so that the ambulance can reach within 10 minutes, and try to teach and try to train the community in buildings, the police force, and all other departments, so that at least the person's lives can be saved. But it's an uphill task, and they could not sustain because the financial things. So according to Dr. Manish Rai, the government should come up and make it in such a way that everyone should know about the CPR. And he also mentioned, like Dr. Daniel, that curriculum it should be added and every child should know about the CPR. Now, Dr. Rai, I would like to know from you. I have asked Dr. Srinivas about the COVID thing. Now, I would like to know, if the COVID status is positive, would you still give the mouth-to-mouth registration? If not, then what do you recommend?
No, I mean, if the COVID status is positive, unless it's in the hospital and you're taking enough precautions, you're wearing a PP kit, it's not recommended to give mouth to mouth. So probably only chest compressions would be good. And if both of them are, wearing masks, then it should be okay. But I think mouth to mouth is generally, even in community CPR, it's not absolutely essential. When you see a bystander, it's not absolutely essential to give mouth to mouth if you're not comfortable. What saves is cardiac compression. So cardiac compression should be given. So I think it wouldn't be a great idea to give mouth to mouth if you're worrying about COVID or anything, unless you're wearing a PP kit. In the hospital situation, it's different. So you can give an ambu bag and all that thing. For bystanders, you wouldn't recommend that. So probably unless you're particularly certain. So, but at least chest compressions can be given, and the idea there would be to get help as early as possible, because COVID and sudden cardiac arrest has got very less chance of survival. So even CPR might not help to a great extent unless you get advanced life support. Unless you get an ambulance and shift them quickly to the hospital. Even if you just provide CPR, chance of survival might not be that very great.
Dr. Srinivas, you were talking about the CPR, which is very much essential, and we have to do it.
Yeah.
But during this COVID time, how do you advise someone to offer CPR in emergency in COVID times? Especially if the affected person COVID status is not known. Suppose I am at the airport and I saw one person having this cardiac arrest. I was not knowing whether he's a COVID positive or not. And can I give at that juncture, can I give this CPR to that patient or to that victim?
That's an excellent question, Mr. Paul. Mr. Goel sir. Yeah, Mr. Goel sir. Now I will demonstrate how to do CPR in situations of when you do it. The American Heart Association and some of the persons have given instructions how to do CPR in situations of COVID time. The problem is, in situations of, are you able to see the mannequin now?
Yeah, we can. No,
okay, right.
no, it's not. Just bring it.
1 minute. Yeah. Now,
yes, now we can.
Situations of out of hospital. The thing is, in situations of out of hospital cardiac arrest, the awareness on cardiac arrest and CPR in our country is very less. Not even 1% of the Indian population, as per one study published, have awareness on CPR. Now, we have seen during COVID times also, because of apprehensions that they will contract COVID from a victim of cardiac arrest. We have seen so many instances in the media where a person is left unattended totally. Now, there is no need to be apprehensive. The guidelines of doing CPR in situations of out of hospital cardiac arrest during COVID times and what I have to do, I demonstrate. The only difference is when you encounter a victim of out of hospital cardiac arrest, first cover the face of the victim with a cloth. Why? The importance of COVID is it is proven that droplet transmission is very important. That means from the secretions or droplets. So if the person has a cardiac arrest, maybe during chest compression, will cut. So cover the face. Are you able to see this? Okay.
Yes, please.
And this is as far as the victim is concerned. Cover the face with a cloth if possible. Second, wear a mask so that the the person who is doing the CPR also is safe. Then do the CPR. Like place the recognized cardiac arrest by tapping the hand, call the emergency ambulance system in your area by activating 108 or any emergency system in your area, and then do place the heel of the hand over the center of the chest and follow the other instructions correctly. And after the procedure is over, while covering the face and nose and mouth of the victim and wearing a mask, after doing the chest compressions, wash the hands with the soap and water. That is the correct instruction during COVID time. But don't leave a person unattended during COVID time just because this one.
Dr. Daniel, in USA, it is a very common practice then whenever there is a delivery takes place of a lady, after that they train the parents for the CPR and for the infants, the newly born. But in India, I don't think there is a protocol to train the parents about the CPR when there is a delivery takes place. Do you think India should do it, or it is unnecessarily they are doing it in USA? What is your opinion, Dr. Daniel?
Sir, can you hear me?
Yeah,
yes, sir.
Clearly.
Sir, whatever said and done, in India, the problem is the awareness of cardiopulmonary resuscitation. The message of cardiopulmonary resuscitation has not percolated into the society. Dr. Srinivas, people like that are trying to communicate it to the public, but it is only a tip of the iceberg. So the problem is that we are not aware what to do when a person has cardiac arrest. There are so many social inhibitions also. In a study, it has shown that in India, even if a person has a cardiac arrest in public, if he is a male, if he's a male person, there's a chance that he can get a CPR. But if he's a female, there is absolutely no way that she'll get a CPR because of the social inhibitions and the legal implications. So nobody will touch a female who's found to be in a cardiac arrest. So we have to legalize the CPR and we have to remove the stigma of CPR to the society. So that is the most important part of it. A program like this will do a lot in this way to communicate this idea, the importance of CPR to the society. And more than that, we have to convey this idea to the administrators. That is very, very important. What I feel is, as you said, in US, it's far away from. We are around 200 to 300 years behind US in these matters. So we can't compare anything to US in that because their system is totally different. But what we can do in our country is, what I feel is, we have to make sure that this CPR is a part of the curriculum. The CPR has to be made a part of the curriculum, and this training has to be cleared by every child, every student. Once he completes the matriculum of the school, they should be aware and they should be clear this with practical examination so that they communicate this CPR to the further generation. That is what I say.
Dr. Srinivas, what Dr. Rai mentioned about the PPE kit in the hospital. Yeah. Now, what happens if a suspected COVID person collapses in hospital? Before you get time to wear PPE, he's in hospital and he collapsed because of the cardiac arrest. And one moment, I will just mute Dr. Rai. One moment, please. Dr. Rai, I have to mute you because it is disturbing. So now I muted you. Yeah. So Dr. Srinivas, the patient collapsed in the hospital. Before you get time to wear PPE, would you advise risking a doctor's life to save another one? Yes, please.
Are you able to hear me?
Yeah, please.
Yeah, good morning. As far as the PPE kit in COVID time, the American Heart Association has given guidelines for management of in-hospital cardiac arrest very clearly. Now, as far as your question, wearing a PPE kit once a part, it is nothing. Now, during COVID time, It is mandatory that every hospital personnel, particularly those in the ICCU settings, in the emergency care, both the intensivist, anesthetist, and cardiologist, intensivist, emergency physicians have to wear a PPE kit and then only work in the emergency care setting. So that is one thing. So it is only a presumptive thing that without a PPE kit, someone is attending, because already it is expected that the emergency physician or intensivist has to wear a PPE kit in the this thing. Now, even the casualty, suppose if it's in the casualty, like in emergency this thing, they have to wear a mask at least. Then in the all those in the casualty of the emergency department or in EMD, what it is called as, they are expected to wear a kit at least. We have what is called the outpatient kit, wear the gown, mask, and then do that. And all those in the emergency setting have to wear an N95 mask. Second, suppose by chance the emergency physician who is already wearing a kit or a nursing staff who is wearing it are not available when they are expected to, and some staff is there on the picture, on the scene, then at least nothing is, we cannot leave him. We have to cover the face with the cloth and then wear a mask. Already in the emergency care, they should wear a mask and perform the cardiopulmonary resuscitation as far as in-hospital cardiac arrest is concerned. And even the AHA has given guidelines for how to ventilate a person in situations of cardiac arrest also. I think that is beyond the scope of this talk because that is meant mainly for medical personnel.
Okay.
The clear guidelines have been given how to do a ventilatory care in the setting of a COVID person or non-COVID person having a cardiac arrest in a IHCA in-hospital cardiac arrest situation during COVID times. Because in COVID times, even if it is not proven COVID also, we have to presume, because we do not know whether the in-hospital person has a COVID or not, if he is not investigated. As you know, in our system, how many people are being investigated for COVID correctly? And how many in-hospital people, like the reports are incorrect? So we have to presume that the person is having COVID and then do the CPR. That's a dictum.
Okay, thank you, Dr. Srinivas, for giving the details. Now, Dr. Rachel Daniel. Dr. Daniel, do you think CPR training will change during and after COVID? What training was given to doctors or to the public at large will be changed? What we were receiving earlier, the training, now the training after that, during the COVID and after the COVID, will it change?
Sir, the CPR, the protocol is changing every year. Now 2020, there is another revisions are coming. So many revisions are coming. And previously we used to give more, it was ABC, airway, breathing, circulation. That was the dictum, that was the order. First we have to come give artificial respiration, given more importance. Then only come the chest compression. But now it is the reverse. CAB, compression is first. Compression, and compression. Now the BLS, that is the basic life support, is giving most emphasis, maximum emphasis on compression only. So whether it is COVID, before COVID or after COVID, now the government HA is giving maximum importance to compression. That doesn't vary from a COVID or a non-COVID situation, because as Dr. Srinivas has mentioned, you can take adequate precautions and give compression. That even hands only compression, even if you don't know any basics of CPR, you can just know how just to press on the sternum, max with a pushing on the sternum hard and fast will do at least 50% purpose of cardiopulmonary resuscitation. So before COVID and after COVID doesn't mean, but it's only about the precautions that personnel who are giving that it has to take. But otherwise the protocol is almost same. You have to give maximum compressions at the earliest way. That is the message of CPR before and after COVID, sir.
Okay, thank you very much. Now, I would like to ask Dr. Rai. Dr. Rai, overall, who should receive CPR training? Should it be made mandatory in schools and all offices?
As I told you, CPR is not an option. It should be compulsory for everyone. Every responsible citizen of India should know CPR. No matter what he's doing, he should know CPR. And I think it should start, like many of my colleagues said, it should be a part of the curriculum in schools. The best strategy is, go from the children and train the parents. So, if you train the children 100% they're going to go back home and train their parents. They're going to tell the parent that they learn CPR in school. So the parents also will be educated. So I think it should be, it should be made compulsory beyond. I think, if I'm not wrong, anyone beyond, 10 years or something can learn CPR. So even a child, as young as, 10 years can understand the concept of CPR, can understand how to, identify when someone is not breathing and, can do CPR. Not to great extent, but can learn the concept of CPR. So if you can start at a middle school level and then every year re-emphasize the same point, yeah. So by the time they're in college, they're very well versed with CPR, and you'll have a lot of responsible citizens. And I see, it should not just be CPR. I think it should be restricted to any emergency services, because another thing that we're missing here is, the number one killer in people younger than 40 years of age is road traffic accidents, and that's another condition. You would have seen that many times on TV. You see very unfortunate photos, wherein there's a person lying on the road, and the only thing that people can do is take a photo and circulate it. They don't know what to do at that point of time. They don't know how to help. So I think this emergency services, emergency response should be a part of curriculum, and that emergency response should be primarily aimed at CPR, but also at accident care. What to do when you find someone bleeding, what to do, and how to help him. And that should be actually, it's not an option, I think. It should be compulsory. Every responsible citizen, it's his duty to learn CPR. He should know CPR. But to start off, you can start off probably by schools and by professionals like IT sector, target IT sector, target teachers, target police force, target firemen, and postmen, and so you slowly build up a strong community, and finally make sure that everyone is involved. So
yes, doctor, very nicely you have said, but I will ask now again two things from you. First thing is in your hospital everyone is trained about CPR?
All of them are aware of CPR. The paramedics,
are they trained from right from the watchman, from the security, from the cleaning staff, the housekeeping, all those who are providing even the
we do have regular program. Yeah, see, for this doctors and all that, even for paramedical doctors, it's mandatory. By the time they join the hospital, they have to take a course on CPR. And with regards to the, we are targeting high risk population, professions like this ambulance drivers and watchmen and all the things. We're taking classes for them and trying to train them. It's an ongoing effort. As of now, I would agree with you that not everyone knows CPR. But we are doing educational classes, especially our emergency department is strongly doing this, monthly programs, trying to target people and, trying to train group Ds and all those people in CPR. But yes, a lot of effort needs to be done in that direction.
Okay, thank you, Dr. Rai, for giving your views. I was told that you have to go for some operation, or you want, shall I ask one more question, or you want to go right now?
I can take another question. Yeah.
Then my question is, which I have asked Dr. Daniel, although I've just framed it, I will frame it in a different way. Do you think in India, we must make it compulsory for all parents who are getting a newly child, whose delivery is taking place in their family, and that parents should be trained for the CPR before asking the newly born and the mother to leave the hospital? Like in UK, if a training is not being given to the parents, even for the car seat, they never allow they will not give the discharge. For this also, when you are saying it is very important, even if we are going for the further step of the college and school training, but even if we start from this, that in all the hospitals, whenever there is a delivery taking place, the parents should know, they should be certified, they should do the course there, get the certificate from the concerned doctor, then only the discharge to be made. Do you think it is a good idea? Because India is such a vast country, yes, with more than 1.3 billion people. How to do it when you are talking about the emergency road accidents? I am being the chairman of Organ Donation India Foundation. I know how much difficult it is to create the awareness about the organ donation. So, and you know that more people are dying every day than COVID. Almost more than 1,500 people are dying every day. More than 5 lakhs people are dying every year for want of organ. So, do you think that it is a good idea?
The idea is great, but practicality, the thing is, when someone is coming in for a delivery, they're already stressed out. And, CPR involves a lot of training. So, teaching a pregnant mother wouldn't be so wise, or immediately after delivery. So somewhere down the line, yes, father, yes. So, if you train the father, yes. But I think a pregnant mother at that point who is, who's stressed out about delivery and immediately after delivery, teaching them CPR at that point of time, stressing on CPR might, although it's a good idea, I'm not sure how practical it is. But what I feel on the other hand is, where we can target a lot of youths is driving license. So if you want a driving license, make it sure that they have a register, this one, what a CPR certificate. So only then you get a driving license. And during that time, it's not just CPR. Make sure they know how to handle road traffic accidents. Suppose something happens, how to treat the other person. Not just lift him up and put him in a cab and send him on. How to give him first aid and all this. First aid and CPR. I think that's a good startup point. Maybe at the time of driving license, make it compulsory that anyone who wants a driving license should know CPR. So I think, although your idea is good, but I'm not sure if that's really practical at that point of time.
Yeah? Okay, the last thing before you leave, any suggestions to the government and advice to public? Sorry, other panelists, because he has to go for an operation. He's asked the time, and I also believe that if a life is to be saved by an operation, the doctors, that must be given the priority. Yes, doctor.
Yes, I think it's high time that the government took CPR, seriously, like the West, like US and UK, they recognize CPR is very, very important. Our government seemed to a little relaxed. They are not so, giving so much importance. It's high time they took it as a priority and, made some real effort to turn things around, So I think like inculcating a school curriculum or college curriculum is absolutely required. It's very, very important. Like many of my panelists believe, it's need of the hour. We are losing a lot of life, which can be saved. So, it's high time that the government gives importance to these things.
Okay. Thank you very much, Dr. Rai, for giving your valuable views and joining us.
Thank you so much.
And all the best for your surgery. Thank you very much. Now, I would like to go to Dr. Srinivas. Dr. Srinivas, you have mentioned about the defibrillator and you have shown also.
Yes, please.
In other countries, this equipment, defibrillator, is available in all the malls, stations, airports, all the public places. Yes. In India, as you already mentioned, that it is available in few of the airports.
Yeah.
Don't you think that it should be a compulsory for giving any permission to come out with any commercial place, whether it's a commercial complex or a mall or a cinema hall or a hotel or airport or railway station or bus stand, to have a defibrillator, working defibrillator in India?
Yeah, Mr. Goyal, sir, I will answer this question. I will extend it and I will add some more points. One thing is, this is as part of the awareness, research and training program, ART program. We are trying to incorporate creating awareness on cardiac arrest and CPR in Warangal and throughout the country. 2, conducting research on this. Research on cardiac arrest and CPR in the country, and training the lay public and the medical personnel also, particularly the lay public, under the ART program and what is called the National Initiative of CPR Education and the National CPR Challenge Program. Now, coming to your question, now you have mentioned only AD. It's not the AD alone. Now, in one of the research papers which I published recently in January, February in the Journal of Indian College of Cardiology, the topic was an observation study of media reports of cardiac arrest in India. Now, you must be seeing Mr. Paul and Goyal sir and all the other media people, you must have seen, and all the lay public and the panelists must have seen news of someone dying suddenly while alighting from a train, or some principal or a educationist trying to inaugurate a meeting or a hotel, and then or someone dying for a college suddenly, and some politician while trying to inaugurate conducting suddenly collapsing. These are media reports. Now, the thing is, through the media literacy, we can create awareness on cardiac arrest. So it is not simple AD alone. Every public place in India, railway station, airport, malls, other than hospitals, RTC bus stations, and all these people, staffing these people, from the study, what I concluded was, all these people, because in my study, in India, it is a 20 years study of media reports in India, from The Hindu, Times of India, Indian Express, Hans India, and Pioneer. 20-year media reports. The number is above 1,700. But in this, the cardiac arrest occurred only in railway station, airport, malls, public places, and then grounds. Even the army people, everyone had a cardiac arrest in this report. So the conclusion of that is, people in the staff in these areas have to be trained in hands-on CPR and also install AEDs in these public places. If you go to US, I've seen in airport. Last time I've seen an AED in India is in Mumbai airport. But are the really Mumbai airport staff trained in CPR? And do they know how early a person has to be respond with an AED? I have shared one of the pictures in AED. When I've gone earlier, I've seen AED installed in a Australian airport, and I've seen an AED installed in a Disney World in Singapore. I've seen AED installed in Dubai. Okay, so all these people, not only should an AED should be installed, staff should be trained in hands-only CPR, and government has to take a role. Now, one of the important things as far as I am concerned is I have given letters to the PMO earlier. Like someone had a
Dr. Srinivas, I am stopping you here. I am coming. I am coming to you. I want to know from you in the next segment what you are doing, how you are doing. So that is the next segment. I am going to Dr. Daniel right now. Dr. Daniel, in your opinion, how many people in India are saved every year through CPR outside of hospitals?
Uh, uh, I'm sorry, sir. We don't have any statistics regarding the
That see
that is the worst part. That is what I say. We are behind the developed countries in that aspect. I'm not mentioning about the other part of these developed countries like US and all. But as far as statistics and these matters are concerned, we don't have any reliable data to comment to quote here about the number of people died or number of people saved out of that. I don't think I am absolutely sorry that. So that is where we should start. We should have a definite statistics, and you should know the burden of this problem. Burden of not knowing CPR should be communicated to the authorities. That is the best thing. That is important. When an election manifesto comes, they will bring so many things that we will bring that. But a good party should bring this as a part of the election manifesto, because make everyone aware of CPR and everyone train CPR in the proper way. That should be a part of the manifesto of in any party. That is my suggestion. And then comes the statistics. Then another thing we can do is we can ensure this program is going on in some resident associations, because resident associations are small groups. There somebody will be the president and secretary, so those people should be aware, should made aware of this CPR, and there should be some organization to carry out to propagate the CPR study to the public. So they should be given the logistics and the amount. That is what Dr. Vanish said. When it comes to the finance, there is definitely matter. So government should make sure that there is an agency to communicate this CPR to all people. Then when it comes to the who should be studied, as he already said, those who are in the society, very accessible, like policemen, firemen, all these. The other part we can do is every relative of a patient who is likely to have a cardiac arrest should be trained. Even we have to apologize that we are not giving training to all the bystanders of people with even heart attacks, so that once something happens, they should be jumping upon the patient and do the CPR. So that there also we can start, because they are the highest possible candidates. So we should give training to people who are likely to have a cardiac arrest. And another important part is we can incorporate this some social media app, so that we can identify the rescuers in the immediate vicinity. So because when you find someone is collapsing, nobody knows if there's a sap or something, so that you can be intimated immediately, and so they can reach the place and the rescue team can come. So we can install some app to be designed in such a way that we can find the rescuers in the immediate vicinity of the arrest. So in many ways, you can percolate this message to the society, and Dr. Srinivas sir will definitely have suggestions in that matter.
Yeah, thank you, Dr. Daniel. You made 2 points. One point is very strong about the political manifestos. In India, our manifestos are to show the dreams, and the manifestos legally stands nowhere because no one can force whatsoever the manifest written in the manifesto. Number two, what you said that we must create awareness. Yes, that is very much required. We must do it, and it should be done from the persons only. But only thing which all of you are saying about the government should do this thing. Why not the civil society should do it? But before that, I would like to now go to Dr. Srinivas. Dr. Srinivas, you have done lots of research. You have done, you have approached, you have given, and you are awarded by Prime Minister Honorable Shri Modi also. But we would like to know from you. Now, you have worked for so long. Are you satisfied that whatsoever you have done, or you still want that so many things should come so that we can save lives? Dr. Srinivas, please.
Yeah. Goel sir, are you able to hear me now?
Yes, yes, please.
Okay. So before answering your questions, first, as far as your question which was put to Dr. Ashil, was survival rate. In the epidemiology, the observational studies on media reports and the recent study which I did, which I will cover later, the survival rate in the media reports is because one anesthetist in Mumbai airport saved a person, one army person who is trained in CPR has saved a person. In that, the survival rate percentage is 1 to 1.5%. 1.5% as far as my study is concerned is the only one real-time study from media reports. And as far as the Warangal area out of hospital cardiac registry study, which is going to be published shortly in the Indian Heart Journal, which is going to be online, survival rate is nil. Okay, now because the system is like that, we need to move from 0% to 10%, and definitely I'm positive that we are going to reach it with everyone's effort. Now, as far as my work is concerned, I'll come within few minutes. I'll cover what I've done.
Yeah, please explain.
I'll cover what I have done, what needs to be done by everyone, and what is the research which we have done. Now, how I started this program, the last 20 years, I have been following 99 when I start my practice, I evolved what is called the Know Your Heart program, in which the awareness on cardiovascular disease, symptoms, and every disease of heart is very less in our community. Then I have written what is called the Know Your Heart booklet in the English language and the regional local language Telugu. After that, we through every World Heart Day program and free camps and awareness programs, I used to do it in the public, the original native language Telugu. After that, I evolved tobacco prevention programs. From 2009, I started the CPR programs. How? I think that as a media person, Paul and Goel sir should know this. While I was browsing through the net, I came across a sudden cardiac arrest report of Mr. Tim Russert, who is a media person in US. In 2008, Tim Russert was a very famous person that it used to be told that anyone can face in the world, but they cannot face Tim Russert. He was a famous media person. And while conducting a media report in the NBC Washington studio, he had a cardiac arrest, and when the 911 team arrived, they were stunned to see that he was not getting CPR at all. And that created a lot of furore in US. Now, this made me, and when it is done in a country like US, I think why not do such CPR programs, awareness in India? That's one thing. Second, I think Dr. Rachel, Dr. Manish, and all the panelists and even lay public should agree that every now and then, when we encounter a person, he says, sir, suddenly my friend, he spoke to me around half an hour back, but next half an hour, I got a phone call from other friend that he's no more. He died of stroke. Or they say that some important person, VIP, the news says he had a cardiac arrest and died. But what are we doing? Nothing. We are not improving the system to improve the survival rate from out of hospital cardiac arrest. So the first thing what I started is in 2009, I borrowed a mannequin from the local MGM hospital, which is a large mannequin. After that, I procured mannequins from various organizations, personally I purchased, and we have got 20 Little Annie mannequins. These are manufactured by the famous company, Lairdale Company. On these 20 mannequins, I teach 20 persons at a time. And then from 2010 onwards, I made it. 2012 onwards, railway station, airport, then the local press people, banks, high school children, all these people, around 100 organizations are identified in the Warangal city, and which probably is the only city in the entire country where we have targeted the entire population systematically. And 2012 we did the largest one. Maybe this is not a record which I claim, but there are so many people, even in the Kerala, they attained the Guinness record. Savita University has attained the Guinness record. See, the purpose is not to attain the record. The purpose is every layperson in the country has to be trained in CPR. Now you might ask me, are everyone doing as per inter? Yeah, in US, the American Heart Association, Canadian Heart Foundation in Canada, Singapore Heart Foundation, British Heart Foundation, everyone does these programs. But all the programs there, for the lay public also they charge, there's a fee. But we are doing it, I've been doing it free of cost. One of the persons asked me, I divide my time between my practice and conducting the community CPR programs. Even one person. No, the American Heart Association and the ACC says prevention of sudden cardiac arrest as per their guidelines. Even in our clinic, We follow training the family members of those with cardiovascular disease specifically, and everyone in our clinic. We share the YouTube video which I created in the local language. Then after that, 2015, I started what is called the National CPR Education NICE program, and where all the CPR knowledge is, as far as the pamphlet which I shared with you, have translated to different Indian languages: Kannada, Malayalam, Urdu, Hindi, and all the Indian, or 11 or 12 Indian languages. And in 2019 World Heart Day, we initiated what is called the National CPR Challenge campaign. In this, not only me, everyone who attends my clinic, starting from a ground level person to a VIP, or even those doctors, everyone. Now, who can be targeted? As far the AHA is concerned, any person from 13 years has to be trained in CPR. That the only thing what they need is they need to have the energy, and they need to have a comprehensive knowledge what is CPR. So starting from middle school, high school, and college. Now, for information and of the Sri Goel sir, Paul, and the viewers, in USA, most of the states, they make CPR training mandatory in the college level and the high school level, a certification. And as for the after this, that is a national CPR challenge shared with the local MPs, politicians, and all. Now, what the government has to do, what the media has to do, as far as my this thing is concerned, I've been giving letters to the PMO, and hopefully he will answer correctly. I hope one day the Honorable PM during his tenure will share the knowledge of hands-on CPR in his Mann Ki Baat program, which I requested earlier. There's a logo which we created also, map of India with the hands-on CPR logo. Now, the second thing is media is the most important, both the private media and the national media, which again I requested the Ministry of Information and Broadcasting has to, like in USAHA, the 1 minute CPR propagated without any conflicts. This is the only program which can be propagated without any conflicts of interest, isn't it? We have to divide our time and train people. So under the National CPR Challenge program, each one train one. Mr. Goel will teach another one. That another one will treat another one. That's how the concept of CPR goes on. The other thing is, so media, both the private English channels, local language channels, and the central government, the state governments have to do. At this point, I give my experience. In 2015, under the NICE program and the CPR challenge, I requested, I have given a letters to all the health secretaries and chief ministers, including the PM in 2015. I got a response only from Gujarat Chief Minister, then Srimati Anandiben Patel, that they will follow it. So in India, if Dr. Srinivas or Dr. Rachel or some XYZ says, people don't listen. My people listen to only the people who listen to my words are my patients and local people. That's all. So if you want to see that every victim of cardiac arrest survives, with the higher run people, those in the administration, the IAS officers, IPS officers, who hope they are listening my words, they are the ones who see that mandatory CPR training is given to everyone from high school, college, and every department people. Police people also we have trained. That's one thing. Second thing is the politicians, those in the government, those who are in power, they have to make it mandatory. Now, does it involve any cost, as Dr. Manish has told? No. As far as I'm concerned, the mannequin, simple mannequin costs 2 to 3,000, but the mannequin which have cost of 10 or 12,000 or maximum 15,000. Again, I would like to remind, apart from the simple mannequin, we have got what is called as the quality CPR mannequin. Now, lay public has to, well, what I am giving training, is it correct or not? How should I know the person I am training, is he receiving the correct training or not? So the AHA recently has given a mandatory that all the CPR training should be done with a quality CPR mannequin only, where the person is given a feedback that he is learning correctly. This is through an app. In the iPhone, we have an app, iPhone or iPad, we have the quality CPR app, and the mannequins will have an equipment where at least 80 or 90% of the compression should be correct. And whether the AED usage is correct or not, this is about the quality CPR. Now, I would like, more than what I am doing, I would like to tell about the 2020 guidelines. The AHA in 1960, American Heart Association gave the first knowledge on CPR in 1960. We are 60 years now. Now, is the survival rate improved? No. Despite 60 years of knowledge on CPR, survival rate of out-of-hospital cardiac arrest is still less than 10% anywhere in the world. To increase this from 10% to 100% for everyone, every life is important. a trained rescuer should be there, and the trained rescuer should be trained. This is now the 2020 guidelines. The chain of survival concept is early recognition of cardiac arrest, activating the emergency system. 2, providing hands-on with CPR or high-quality chest compression. 3rd, defibrillation with a automated external defibrillator. 4th, advanced resuscitation when shifting to the ambulance with paramedics. Then the 5th one is the post-cardiac arrest care. Okay, in the hospital. And the last one is recovery is the one which is added as per the 2020 guidelines. The other new thing about the 2020 guidelines is usage of virtual models. The COVID time, virtual reality, like even without training hands only in a practical way, through virtual way we are training CPR. The Lairton has given a model for this, how to train virtually, lay public and others in CPR. 2, just if you train once, it is not enough. Booster training is required. Periodically, the AHA and ACC say that American Heart Association, we need every 6 months, we need to have apart from training, the traditional way of training in hands-on CPR, what I have done, the mass training, what I have been giving earlier, the self-directed learning is very important. Every individual should train himself self. There are a lot of things in the AHA website, how to learn self. Okay. Second thing is through virtual reality. The other thing is booster trainings. Every 6 months they have to do that. And for information, in the US, every airport also has got a kiosk, where in some of the airports I've seen in the AHA conference earlier in session, there's a kiosk where a model is kept and the person has to go to the kiosk and train himself correctly. This is about the these things. So I told you about what I've been doing. I've trained more than, I don't count, more than 20,000 to hundreds of such programs. And what is the number of the attendees? Even if the one attendee, it's important. I train only one person who is in my clinic in CPR, the family member, one person, 2 NCC cadets, NSS cadets, and all these things. So I request the viewers, particularly those in the IAS officers, IPS officers, those in the administration, even the judiciary also, judges who are in the viewing one, seeing this, they have to make it mandatory because they have got power. I don't have any power to see that ensuring everyone. I cannot see that it's mandatory. So last thing is about our research. Epidemiology of out-of-hospital cardiac arrest and knowledge of cardiovascular disease and risk factors in a regional setting in India, the Warangal area out-of-hospital cardiac registry study. I have been the principal investigator. Dr. Vemurumurthy is a co-investigator from University of Illinois, the other faculty from University of Illinois, and local person, my teachers and friends. This is done in a regional setting in India. All those cardiac arrests. Now, the 2020 guidelines of AHA says that data registry is very important. Collecting data on out-of-hospital cardiac arrest, in-hospital cardiac arrest. One of the media persons questioned me, when already the person is dead, why do you need the data? Yeah. The very important. The question is, when the person is dead also, you have to collect the data, how the person died, what are the symptoms. This is as far as the international model, what is called a Epstein template. If we do that, collecting the data on cardiac arrest, we will know how the person died and what are the previous symptoms, whether the person received CPR or not. Only 40%, 30 to 40% of victims of cardiac arrest in the US receive CPR. Out of those, and AED usage is done only in 10 or 12% of subjects. In an advanced country, that means we need to have more and more people trained in CPR and AEDs also. So this study, registry in a regional setting, India will give how to improve the system. Without having the data analytics, how many people are dying due to cardiac arrest, whether CPR was done or not, whether the AED is installed or not, how early the ambulance arrived. You ask any person, no, it is not a mistake. Mistake is a mistake if it is not corrected, isn't it? So if the ambulance doesn't arrive less than 10 minutes, within 6 minutes, which is maybe difficult, but it's not impossible. We need to have the structured roads, everything. The community should be sensitized in handling a cardiac arrest, then we can improve the system, isn't it? So once again, this needs to be improved. In this study, we studied this and none of them survived. No, this is a sustained program, WACA registry, and also I just wanted to tell what needs to be done, and what needs to be done is the most important thing in India. And we are going to, we can prove this, we can improve the survival rate of out-of-hospital cardiac arrest victim. The other thing is accountability, awareness, accessibility to cardiovascular services. And
Please be brief.
Thank you so much. And
Thank you very much, Dr. Srinivas. Dr. Srinivas has given the complete details how things can improve and what he has done, and how the community and especially all the senior persons should be involved with those who matters, who are in administration or judiciary, etc. And he mentioned about the ambulance. I would just like to inform you my own experience in London when I had a massive heart attack. The ambulance reached in 3 minutes. So when there it can reach in 3 minutes in London city, why in India? After all, we are also human beings. Indians are also having the precious life as they are in London or any other country. So I think what you have said, yes, we have to think and consider very seriously. Now, in the last, Dr. Daniel, you have any suggestion to the government or public at large? Please be brief.
No, sir. My main suggestion is make it a part of the curriculum, because no school or college has a mannequin in their lab. So a mannequin should be, as I said, a high quality mannequin should be part of every school and colleges. Then that means that is incorporated into the younger generation.
Okay, thank you, Dr. Srinivas. One suggestion, if you want to give anything to the government or public. In brief, please be brief.
Only
Mr.
1 minute?
Yeah, not even 1 minute, 30 seconds.
Okay, right.
Any suggestion?
Every government official, every government, the politician, every judicial person should learn hands-on CPR. So if they learn, they have to see that, ensure that other people learn.